One of the best things that has ever happened in dentistry is dental implants. They're a pretty routine treatment now for missing teeth, individual teeth, multiple teeth, or all of your teeth. And much like a hip implant or a knee replacement, material is the same. It's medical grade titanium, but the safest materials that you can use in order to rebuild your quality of life. In the old days, if you're missing a tooth, there were not very many ways of replacing the teeth, and most of them didn't feel like teeth. If you were missing one tooth, say a front one, you would have a flipper, a little small single tooth denture. You couldn't eat with it. If you smiled or you sang in church, it would fall out. That's pretty embarrassing. And that usually led to more and more teeth being lost, getting closer and closer to a full denture. One of the other ways of replacing an individual tooth or a couple of teeth is to do what's called a bridge. Now that's fine if the neighbor teeth that we have to work on to make a bridge are broken down or need large fillings or crowns or that sort of stuff. That's okay. But what if you're missing one single tooth and the neighbors next to them are perfect? You're going to sacrifice two good teeth in order to replace one that you've already missed? So what a better way of replacing that individual tooth would be with an implant. The costs are very similar to a bridge. There's no big difference between an implant and a crown or a bridge, except for your long-term cost. If you place a bridge to replace a missing tooth, you may have to replace that bridge after a few years or 5 years or 10 years. You may have to do a root canal through one of the attachment teeth. The bridge may get loose. It's always a multiple tooth problem. You're always going to have to work on replacing those over time. Implants, they don't get cavities. Implants, as long as you're healthy and take care of them, they usually don't go bad. So an implant really is a lifetime solution for the same cost as a bridge that may be a 5 or a 10-year solution. And when you have to replace a bridge, it's always going to cost more. Dental implants here at Lathrop Dental Center are a pretty routine thing for us to do. We use 3D technology prior to any implant placement because without that, it's really just not safe. We can plan everything before we get started as far as implants go by using our 3D technology. We can look at how long we need an implant or how many, the best way of placing them, any number of things.